Namaste and welcome. So we are going to continue with the series on breast and we are going to start with the augmentation of breast. Thank you for all the great feedback that you have shared on my channel. And so today on Teachers Day, I'm going to post 3 videos and cover all the important aspects on breast augmentation. So now, as we have seen in the first video, the basic parameters, that is the basic landmarks for any breast surgery, remain the same. So with the patient in the standing or in an upright seated position, we are going to mark the midline of the chest and the breast meridians. Other than that, particularly for augmentation, which are the important markings that you should be aware of? So we know this marking as well, which is from the suprasternal notch to the nipple distance, and we also know about the inframammary fold marking and the intermammary distance. Usually this IMD, that is at least 2 cm on either side of the midline, is considered to be a no-go area. So whenever you are doing any form of breast surgery, you do not violate this region, otherwise it can lead to symastia. Coming back to augmentation, so what is BH? BH is the breast height. Basically, that is going to be the distance from the upper pole of the breast to the lower pole of the breast. Then we have the chest width. This is in relation to the midline, that is the sternal midline, and to the anterior axillary line. In the chest width, we should also know what is the true breast width, that is the width of the breast tissue. Because we know that towards the midline, as mentioned on either side, there is going to be a decrease in the breast tissue. So what is the actual breast width also should be marked. The most important aspect in case of an implant as well as the selection of the implant is the base width. Now don't confuse the breast width with the base width, because usually when we use the initials BW, we are talking about the base width, which is the width of the implant base which we are going to choose. So whenever we choose a certain type of an implant, there are predetermined measurements of those implants which are mentioned on the box itself, and the most important aspect is in choosing the base width, and we can know that by the measurements of the breast. The other important aspect is this nipple to the inframammary fold distance. So this is also a very important marking, because we have to be sure of this distance in 2 conditions. One is in the relaxed phase and one is in the maximal stretch position. So with the patient in normal anatomical position is going to be in the relaxed phase, that is going to be a standard nipple to IMF distance of the patient. Now once you pull the breast up and then you measure the distance from the nipple to the IMF, is going to be in the maximal stretch position. That helps us to determine how much of lower pole elasticity we have, so that when we are placing the implant, we know about this distance from the IMF in case we have to change the position of the IMF, or to make sure we don't have bottoming out of the implant or a double bubble deformity, etc., as we will see in the following videos. For this video, coming back to the most important part is how do you decide the size of your implant. So depending on the base width of the implant, which then depends on the tissue in the breast. So if we consider the base width of the implant to be X, then X is going to be the breast width minus the thickness of the tissue. That is, in this case, we are going to consider the width of the breast and we are going to minus the thickness of the tissue on either side, which is determined by the medial and the lateral pinch. So usually we use calipers which help to precisely determine the thickness of this tissue. So we add the thickness of the tissue on either side of the breast, which is on the medial pinch and the lateral pinch, and then we divide it by half. So that will give us the thickness of the tissue. So once we minus this from the breast width, we will get the width which will help fit in the implant. because if you have an implant which is going to be broader here, it is obviously going to go towards the midline, it is going to protrude out on either side, and it is going to show. If you have a very small one, then it will tend to move around in the breast tissue and it will not give the support that we require. Therefore, this formula for deciding the base width of the implant, which then helps in deciding the size of the implant and the type of the implant, is the most important aspect for the augmentation using an implant.